Can I just trail off what Linda Gorman just said? Government is the problem, not the solution. Thank you very much. I'll be here all week. How many of you read the Denver Post? Just for kicks and grins, okay. So I saved the issue, which is Sunday, February 19th, 2012. Why Obamacare is good for America. Do you remember the euphoria, the excitement? It was great. It was going to be wonderful, right? And then you start understanding who authors these articles, who prints them. Okay, enough about that. I want to bring things up a little bit to the real world. We've had some great speakers talking about our whole system. I just want to share a few things about what I see with what I do. I work with people in different markets, Medicare, the individual health market, and small groups. That's really the three sectors we have. It's a mess. It's a total mess. The system, obviously, you've heard some of the issues that need to change. Basically, there's a few things I want to clarify. Does everybody know the difference between health care and health insurance? Because I hear the two terms interchangeable all the time. So what is health care? Health care is receiving a service from a provider. We know a provider is a person or an entity that provides services, correct? But your health insurance may or may not pay for that service. So the left is very good about interchanging this. They call it my health care, my health care. But many times they're referring to the health insurance, okay? Just want to clarify that. So is the goal to reduce health care or to reduce health care insurance premiums? If you reduce health care costs, will you reduce health insurance premiums? Maybe. We talked about cash being a way to pay for health care services. We have a gentleman that's going to speak after I do about a direct pay practice. I'm very excited to hear what he has to say about that. I don't know if you've heard about those types of practices or not, but I think they're going to be one of the solutions. Okay? I'm jumping around a little bit, but I want to keep it light, okay? So, again, government is the problem, not the solution. One of the sectors I work in, I mentioned a few minutes ago, was Medicare. When I solicit business for Medicare, there are certain regulations and rules I have to go by, which I'm okay with. The problem is they're so burdensome, they're just almost unbelievable. So, are any of you on Medicare? Any of you have Medicare? Okay. So, you might love this. There are certain products that I work with that require your authorization prior to me talking to you about the product. Okay. So technically, if you were a new prospect, I would not be able to contact you other than by a postcard. You would send me the postcard back saying, well, I might be interested in talking about this product. I mail you this form. It's called a Scope of Sales Appointment Confirmation Form. Okay. Are you familiar with this? Okay. If you have a Medicare Advantage program, you should be because it's regulatory. I mail this to you, you look at this, and you say, geez, what do I want to talk to this guy about? There's this. I don't know what any of this is. I'll just sign it and send it back. So it comes back to my office. It's blank. You show up for the appointment. I have to have it 48 hours prior to seeing you. I can't talk to you about the product that maybe I'm a little bit more knowledgeable in than you are. What do? It's insane. I can mark you down as a walk-in, but if I have too many walk-ins, I have to report to the government why I didn't get this ahead of time. I saw this the other day. I had to pick this up. So there's an agency, not familiar with them, I'm not going to mention any names, but I get this email. Never spoken to you before. As a trusted advisory service, it has come to our attention that many individuals and families may be losing their health insurance coverage or experiencing dramatic changes in their plan at the end of the year due to changes in regulation for the industry. Here at the name of the company, our goal is to help you eliminate or reduce the yearly cost of your health insurance. How are you going to reduce the yearly cost of your health insurance? Well, that's what the exchange is for, correct? You go to the exchange, you get your subsidy, everything's paid for, but it's free. Isn't it?
No.
Okay. It's not free. We understand that. What is free? Well, we know it's not free. I have another one of my customers who sent me this letter. This is about a doctor's practice that decided they're no longer going to take Medicare. I don't know if that is unusual. I don't know if it's something we're going to be seeing more of. Have any of you got letters from your doctor's office saying that?
Really common. Really common.
Common, okay. But what's interesting about this, Dr. Vecchio, is they decided they were going to take Medicare Advantage programs instead of Medicare. And then they retracted it a week later, which totally surprised me. Okay. So, how many of you know that politics is confrontation? Ask your legislator. It's not fun. It's not a fun business, but it's your way or their way. And I'm not into the compromise. I've seen it. We've done it over years. That's why we're in the position we're in now. So how many of you vote? Awesome. I'm not wasting my time today. Because if you don't vote, guess what? You don't count. I don't care. It doesn't. You don't have a voice. You choose not to have a voice. So thank you for your time. I know I moved around all over the place, but I appreciate being here.